just another old shift. So like all the other days, life as a nurse is hard. But I guess I'll go to see what my first shift calls for. Let's look here on the computer. Oh, yep. Looks like my first shift is in the ER, so let's head over there. Guys, before we begin the video, make sure you like and subscribe. I will eventually be doing giveaways on Maple Hospital, but I do need a bit more subscribers before I can do that, so make sure you subscribe. By the way, I'm inspired by Sasha on Call, so make sure you also subscribe to her. Alright. Let's just go over to the ER and let's see who we've got in here. Alright, Sophia, hello there, darling. I'm going to get a wheelchair. Here. Alright, let's take you. You seem like you might be a bit dizzy. Let's go take you to a pediatric ER room, and we'll read all about you. Alright, there you go. Let's read the EMT note. Ooh, cardiac arrest, weak pulse. Alright, we have got this, guys. So, obviously, she first needs a gown, because hospital policy. Alright, here you are, Sophia. Let's give you that patient gown you want. Oh my gosh, well, you're in luck. It is your lucky day. We have got a bear right here on this stand that you can use. There you go. Just for you. Yes, of course I can turn the TV on. Let's see what channels there are you could watch. Yeah, no. Of course, Valentina. No problem. How about Miss Rachel? I bet you love her. Let's see. I'm going to take your temperature. Let's see. What temperature? Oh, 97 degrees. Not too bad, but, yeah. Let's see. Heart rate. Sounds pretty good. Alright, I'm gonna go grab a vitals cart from the outside. Also, by the way, if the video's glitching out, it's the game, not YouTube. Just so you know. Alright. Oh my gosh, I can see the outside. Okay, it disappeared. Alright guys, we've got the vitals cart. Alright, let's connect this. Alright, let's see. You are coughing. Okay, seems pretty good. Let's see, let's take... Okay, so we took your blood pressure. I think we need to report your vitals, but first I'm going to take this. Alright, let's see. Okay. Okay, I'm gonna go grab an EKG machine. Oop. Alright, let's pop that on here. Oop, doctor has ordered some treatments. Saline IV. Let's get that attached. And let's see. An oxygen mask, okay. Oop. Yeah, oxygen comes out of the wall. It's pretty cool, right? An animatic, no problem. Okay, Sophia, I'll be right back. I'm gonna go grab you some medicine, from the pharmacy. Alright, I'm just gonna go over here. Oop, I'm glitching. I am so glitchy. Alright, let's see, guys. Can I order from Quicksies? Alright, let's get you some animatic. Let's give that to you. Alright, oh, more treatments. Let's see. Allergy relief. Alright, I'll go grab that. I'll just place the order right here. Oh, and while I'm on here, I might as well subscribe to Amy on Call. I just got an email that it is through, so let's go see that. My pager went off. Let's go check the tube system. Yep, this looks like her medication right here. Sophia's allergy relief. I don't know why my game is glitching out so much. I'm the only one in the server. See? Just me. I don't know why I'm glitching out that bad. It should not be glitching. Stop glitching. Bad. Bad glitch. Alright. Here you go, Sophia. That's your allergy relief. I'm gonna wait a couple seconds. Alright. I'm gonna let her sleep. Alright. She seems good to go. Perfect. Let's detach EKG. And perfect. I'm going to take off your oxygen mask, Sophia. And I'm going to go grab your discharge papers. If I can make it to the printer alive. Alright guys, you know, it would be so bad if I got a code blue that time, but she seems good. I really don't like dealing with code blues, and I'm not very good at them. I haven't gotten too many so far. All patients have survived though every time that I've done a code blue, so I don't usually get code blues, but all my patients survive. I've never had a patient die in my care, so it would be kind of horrible if that happened, you know? Alright, Sophia, here is discharge. Oh, sorry, I forgot I need to give that to your mom. Thank you. I'm gonna go file that. If I stop glitching. Bro, stop glitching. It's not that hard. Alright, now that I've filed that, I'll let her go home. Alright. Good day. Alright guys, this is our next patient. Hello, Isabella. I'm just gonna go grab you a patient gown. Okay guys. So she has severe head trauma. We're thinking maybe concussion. And it said she might pass out, so let's just hope we don't get code blue, you know? Alright guys, we're close to the end of the shift, and now we're having Sydney Z, so I'm going to get her pacing gown. Alright guys, so it's been a busy day down here, but now I'm called to the surgery room, so it'd be absolutely horrible if I had a code blue. Cause, yeah. Let's go to the surgery department, and I'll find someone to do surgery on. Alright, Mia, you are with me, my friend. I'm going to scrub in for you. So guys, I don't know what kind of surgery Mia is having. I should probably check that out before I begin. Yeah, I'll go check that out after I scrub it in. I'm just gonna take a sterile towel. I'm gonna put on my scrubs. I'm gonna throw this in the trash can. And let's see, gloves. Yes, let's find some gloves. There's probably some in there, but there's also probably some in here. Alright, Mia, I'm just gonna check and see what you need. Let's see, Mia G. Okay. It looks like you are going to have, tonsillitis removal, tonsil removal. So yeah. I'm gonna pop this on your surgical bed, like so, and I'm gonna wait for it to be brought in. So let me check her chart again. Yes, it looks like she's having tonsil removal. She doesn't have any results on any tests, so I don't know why we're doing this, but it'll be okay. All right. I'm going to introduce myself to the patient. Yes, we are. Now I'm going to go grab a sedative from our closet over here, if my game will load. I'm actually surprised it's mildly loading. Mildly. Now it's time for a saline flush. I'm gonna pop that in her IV. Alright, now she's going to fall asleep. Time for a face drape and mouth expander probably. Time to grab a lap sponge. Alright. Alright, we've got one. Alright. You're doing pretty good. Perfect. We're doing good. Alright, perfect. Now it's time to get our next patient from pre-op, or post-op, or pre-op, sorry. Yes, pre-op. Let's see what each of you guys are going to have. Okay. I'll take, I'm already pretty much scrubbed in. I just need to wash my hands. Perfect. Time for a clean sheet. Let's pop that on the bed, and let's see if she has any test results or anything. Let's see. Okay, she's doing pretty good. Whoa, why do I have two people in the room with me? Okay, if I can get over here. Alright, hello. Time to grab a sedative. Alright, now saline flush. Alright, let's pop that into the IV. Now let's wait for her to fall asleep. I'm gonna grab Betadine bowl while she's doing that. We don't have any sponge forceps over there, so I guess we'll find some in here. Alright, we're doing pretty good. We need to be very focused. Whoa, why is this blood clot not going down? Alright, let's see. Let's clamp it. Hello, I clamped you. I clamped you already. Just clamp. Okay, guys. This is horrifying. All right. Time to remove the tumor. Just like that. Perfect. Okay, we're gonna grab a mobile X-ray machine. Oop. Guys, this is not working. Alright guys, let's do this. Okay guys, so we're doing pretty good. Alright guys, thank you so much for watching. Don't forget to hit that subscribe button if you want more videos like this. And I will be seeing you guys in the next video. Bye.